The occlusal scheme of removable partial denture is dictated by the nature of denture support, or the remaining dentition. There are classified into tooth, mucosa, and tooth and mucosa supported. Just like the fixed prosto cases, the partial denture occlusion could be formulated, using either conformative or reorganized approach. With regards to the tooth-supported denture, most of the cases are conformative approach. The only exceptions to this would be rehabilitative prostheses or the denture is fabricated at an increased occlusal vertical dimension. The occlusion provided by the tooth-supported partial denture on the left side was conforming to the existing occlusion, while the overlay obturator on the right side was fabricated at an increased occlusal vertical dimension using reorganized approach, due to the severe tooth wear on the existing dentition. With regards to the tooth and mucosa supported denture, there are differences in the amount of displacement underloading, and type of deformation. These differences could cause some clinical problems as the occlusal loading is shared between two very different tissues. Therefore, Applegate described a technique of distal extension partial denture fabrication, known as altered cast technique. Besides, realigning may be sufficient to restore the occlusion in saddle areas. The occlusion provided by the tooth mucosa supported unilateral distal extension partial denture on the left side, was conforming to the existing occlusion, while the bilateral distal extension partial denture on the right side was fabricated at an increased occlusal vertical dimension using reorganized approach, due to the palatal tooth wear on the maxillary anterior teeth. Regarding the mucosa-supported removable partial denture, it will lose occlusal contact with the opposing arch, within a relatively short time, as the underlying bone is resorbed. Relining is likely to exacerbate the resorption. The other example of mucosal-supported RPD is transitional acrylic denture or training denture. The occlusion provided by the mucosa-supported partial denture on the left side, was conforming to the existing occlusion. This image is illustrating the iatrogenic effects of selecting a mucosally supported design. Sometimes, the term gum stripper is used. The partial denture on the right side was fabricated using reorganized approach at centric relation. Due to the denture opposes a mandibular complete denture. This slide is explaining the desirable occlusal scheme of removable partial denture, to enhance stability of the dentures, and to develop a harmonious occlusal relationship among removable partial dentures. First, simultaneous bilateral contacts in maximum intercuspal position for all removable partial dentures. Occlusion for tooth-supported RPD may be arranged similarly to the occlusion seen in a harmonious natural dentition. Bilateral balanced articulation should be arranged when a maxillary complete denture opposes the RPD. Only working contacts need to be formulated for the unilateral distal extension RPD. Regarding maxillary bilateral distal extension RPD, simultaneous working and non-working side contacts need to be achieved. RPD to replace anterior missing teeth. Denture must be in contact with the opposing teeth. Last, artificial posterior teeth should not be arranged farther distally than the beginning of a sharp upward incline of the mandibular residual ridge. Pertaining to the complete denture occlusion, we must remember that there is no tooth-determined occlusion, no vertical reference point, no horizontal reference point. Therefore, the condyle position is the only reference and occlusal vertical dimension, OVD, has to be estimated using freeway space. These two images have shown the patient's occlusal vertical dimension was correctly achieved in centric relation and her lips support was restored after the complete dentures were fitted. There are 3 intraocclusal records for complete dentures: centric relation record at correct OVD, check record or clinical remount, and protrusive record to set the condyle angle. These images have shown the step-by-step how to take centric relation and face per record, transfer them to the semi-adjustable articulator, and mount the maxillary and mandibular casts together. The purposes of the check record are to eliminate errors in occlusion arising from processing complete dentures, to eliminate small occlusal errors missed at previous visits. After the selective grinding, balanced articulation is achieved and dentures are fitted again. There are three aims of complete denture occlusal scheme. First, to minimize the displacement of complete dentures during function. Second, to minimize the load on soft tissues during function. Third, to maximize the chewing efficiency. There are three ways to minimize the displacement of complete dentures during function: prescribe the balanced articulation, and maximize the retention and stability of the complete dentures. Regarding the second aim, we should design a complete denture using narrow occlusal table, maximize the coverage of soft tissue area, minimize the lateral forces using balanced articulation, engage the mandibular denture into postmylohyoid fossa and achieve balance between the tooth position and muscles. These are the methods to improve the chewing efficiency, including choosing the cusped teeth, record the centric relation accurately, good interdigitation, design the correct occlusal plane and accurate teeth setup. With regards to Hanau's quint, there are 5 determinant variables affecting occlusal contacts in complete dentures, including orientation of occlusal plane, Candler guidance, incisal guidance, cuspal angle and compensating curve. Pertaining to these 5 factors, Candler angle is a patient factor and you cannot alter it. Occlusal plane cannot be changed significantly due to the functional requirement. Therefore, the other 3 factors might be altered to maintain the balance without compromising the aesthetics and phonetics. These diagrams has shown you when all 5 factors are in balance, the complete denture will maintain simultaneous gliding contacts in all excursive movements. The most commonly applied occlusal scheme for complete denture patients is balanced articulation. The characteristics of this occlusal scheme including maximum intercuspal position at centric relation, even simultaneous gliding contacts between anterior and posterior teeth in lateral excursive and protrusive movement for both working and non-working side. These are the images to show balanced articulation, which are simultaneous gliding contacts between anterior and posterior teeth in lateral excursive and protrusive movement.